Hello, my name is Paul Essner from Risk Strategies Company, and today on behalf of Juniper Communities, it's my pleasure to provide your 2018 Employee Benefits Overview. We'll cover many interesting topics during the course of today's discussion, including health insurance, which once again will be provided by Horizon Blue Cross and Blue Shield or your local Blue Cross and Blue Shield affiliate. Plan options are the same as 2017. We have dental and vision insurance available, and we're going to talk a little bit about the programs from United Concordia and IMED. We have a brand new enhanced benefit resource guide providing benefit at a glance and a little bit of a deep dive on what's available this year. A new voluntary benefit provider, which is Aflac. We're kind of proud of bringing Aflac into our program. We'll explain to you why and what the opportunities are. And then finally, there'll be individual consultations as arranged by the business office managers in each location that will give you the opportunity to ask individual questions and make some educated choices. For starters, let's talk about Blue Cross and Blue Shield. The network is the same in 2017 as in 2018. We know that your coverage, if you don't live in New Jersey, provides access to your local Blue Cross affiliate. When searching for a doctor, you would just use the term Blue Card PPO to find the right doctor in your network locally. You might also note that if you have a card or when you receive a card, that there'll be a Blue Card logo on the card, which is an indication both to the doctor's office and to you that you have access to your local affiliate. As always, there are no referrals required in any of our plans. And one more important point to make, as we are in the healthcare business, that preventive care, checkups, and the like are covered at zero cost in network for all people that are enrolled with Horizon. But the value of preventive care is only felt if you use it. So we want to encourage everybody to use their benefits to go get a checkup. And when getting a checkup, there are several services that you're allowed to have that are covered in full. If you go to the healthcare.gov website, you'll be able to see the selection of things that are available based on age and gender. And all of those services are available at zero cost. For example, everyone is entitled to an annual physical exam. Ladies are entitled to 2 visits to the gynecologist, diagnostic mammogram at age 40, and all are entitled to a diagnostic colonoscopy at age 50. These are just a handful of the services that are available to you for screening and review. And we always make recommendation to you that to use these services, and now it's even easier than ever because as long as you use an in-network provider, the cost is zero. Plan options are the same as in the past, which is our gold PPO, our silver PPO, and our bronze EPO. And your salary deduction cost varies based upon the plan you select, with gold being the highest, silver being the middle, and bronze being at the lowest rate for you. But picking the plan is also based upon the benefits that are available. In our gold PPO, you have in and out of network services available, and the copayment is $15 in network for a primary care physician and $15 to see a specialist. Now, primary care physicians generally are internists, family practice doctors, OBGYN, and pediatricians. When you go to see those doctors, you're generally seeing a doctor who's considered primary for the insurance company. But even if your doctor is not considered is a doctor that is not considered is considered a specialist, they may not be considered a primary care doctor for Blue Cross, and what their contracting is what matters. The deductible in our program is $500 for this plan, but that $500 deductible only applies to services that take place outside the office visit. If you're enrolled as a family, it's $1,000. After that deductible is satisfied, there's a coinsurance of 20%. That coinsurance then continues until you reach a new factor called the MOOP. The MOOP stands for the maximum out-of-pocket expense. The MOOP on the gold plan is $2,500 for an individual and $5,000 for a family. So if you were to add up all the costs that you pay out of pocket for your health insurance between copayments and deductibles and coinsurance and prescriptions, which are also available in 3 tiers as in the past, you would never spend during the course of the year more than $2,500 if you're enrolled as a single, or $5,000 if you're enrolled as a family. The benefits provided by the insurance company are then unlimited. So heaven forbid you should have a serious illness, your total cost would be limited to that MOOP. Using that same concept, we move into the Silver program, which has slightly higher copayments at $25 primary and $50 specialist, and a higher deductible at $2,000 single, $4,000 family, and a MOOP of $5,000 individual and $10,000 family, and the same prescription card as the Gold. So now you begin to see why you select one plan versus another. It's based upon whether or not you want to spend less out of your salary deduction because you don't anticipate having higher expenses. But regardless, you still are supported by the idea that you'll never have a maximum expense to exceed $5,000 or $10,000 during the course of the year. Finally, our lowest cost plan, our bronze plan, is different because it requires that a deductible be reached before you get to use the copayment factor. So what happens when you go into the doctor's office? Well, simply put, you will pay whatever is the cost of services as negotiated with Horizon Healthcare, which means the doctor can never balance bill you for those services. They can only bill you the amount that Horizon approves. After the deductible is satisfied, the cost of the office visit is $30 primary and $50 specialist. But just understand that if you go for preventive services one more time, we know that those costs are at zero. So this really only applies to what we call sick visits rather than well visits. The deductible is $1,500 for an individual and $3,000 for a family, followed by a 50% cost share and a MOOP that's the same as the silver. In the case of the drug card payment is 50% of the negotiated rate for the medication. So in the final analysis, if you first satisfy the deductible before the deductible is reached, you'll pay 100% of the drug cost. And then after the deductible is reached, 50% of the drug cost, and all those numbers are added up until you reach the MOOP. In our benefit guide, we also feature information about an app and a website called GoodRx. And GoodRx is an excellent resource, especially for people on the bronze plan, because it will provide the lowest cost place to go get your prescriptions filled. This allows you to be a good consumer and keep your costs down. But on the backside, always remember that if you have a serious illness, your total expense could never exceed the MOOP. We have two dental plans that are available through United Concordia. Our high plan has benefit services for Class 1 diagnostic, Class 2 basic, and Class 3 services to a maximum benefit of $1,000. The program does have a deductible of $50 per person, no more than 3 per family, but it's important to mention that in the spirit of prevention, there is no deductible that's applied to preventive services. So if you use this program to go get your checkups and your x-rays and cleanings, you'll be able to get those services at 100% coverage, an excellent program to help provide and foster dental health. Our lower cost plan has a $500 maximum and no deductible, but it also features no coverage for Class 3 services. So just understand that if you have this program, that you will not be able to get coverage for an inlay or a crown or for an endodontist. Finally, our iMed program provides excellent services for vision care. Routine vision care is never covered by health insurance, but if you have your iMed program, you'll be able to see an iMed participating doctor and get a dilation and an exam for $10. If you go to see a non-network doctor, you'd also get an allowance. The real benefit of this program, in addition to motivating you to go get an eye check, is the ability to get contact lenses and glasses and frames at not only a low cost, but also at a significant discount and reimbursement. We use the program every single year to make sure we get our contact lenses prescriptions filled, and you get a $150 allowance immediately for contact lenses. So consider the iMed program and whether it's something that you want to take advantage of. Well, once again, as I mentioned previously, the best information source will be our new benefit guide that each of the business office managers have available for you. And for 2018, we have updated it. And inside the kit, you'll have many pieces of information to explain elements of not only your benefits, but other resources that are available. It also has a slide to explain how you go onto the ADP portal to enroll, because this is how we enroll in our benefits here at Juniper. Plan summaries for the health insurance and dental plan information. This is the best resource to help you understand what you need to know in order to have a good decision making. I mentioned in the opening that AFLAC is our new voluntary benefit provider. Many people have heard of AFLAC, and we should point out they are a world-renowned provider of voluntary worksite benefits. Allstate's no longer going to be offered as a payroll-paid program here at Juniper. And you could choose a new AFLAC program during the open enrollment period, but just understand that we will no longer do salary deduction on the Allstate program. If you voluntarily, if you had benefits under Allstate, you will receive at home an offering to continue your benefits. But if you sign up for the new AFLAC program, you can choose whether you want to have both or only one. But you need to take action to sign up for the AFLAC because it won't automatically roll over from Allstate to AFLAC, and you can make that decision on the ADP portal. The reason we made this selection was not only the notoriety and benefit and quality of AFLAC, but most of the programs have lower cost and better benefits than the Allstate program. Well, who is AFLAC and what is voluntary insurance? Well, we know that AFLAC is a well-known leading provider with over 60 million policyholders worldwide. But it's also one of the top 100 ethical companies in the world as measured by Ethisphere. And AFLAC is also known as a company that pays claims fast, most within 4 days. So understand that voluntary insurance programs aren't major medical, but they're designed to complement your coverage. And we have the same 4 types of plans that we had in the past, but we're happy to report that most of them are lower cost and better benefits. And this was the mission of trying to overhaul and improve this program. So AFLAC is not major medical and it's not Allstate, but what it is a supplemental program that provides benefits. And the 4 programs available to Juniper employees are critical illness, hospital indemnity, short-term disability, and 20-year term life insurance. These plans are group rated to keep the cost down for you and are all available by payroll deduction. Once again, this is a replacement for the Allstate program, which will no longer be offered here to our employees, but you must enroll on AFLAC if you want it. And if you were to leave Juniper, the coverage is portable. Best of all, AFLAC pays the cash benefit directly to you without going through your employer, and they will receive no information, Juniper, about your claim. To give you a little deeper dive on the benefits, the critical illness program allows you to select a benefit level between $5,000 and $20,000. And then the amount of benefit you receive is determined by the nature of your critical illness, as you can see from some of the illnesses on the right side of the page. Whether cancer or stroke or kidney failure or loss of sight or hearing, paralysis. These are all critical illnesses, we understand, but the ability to get an immediate cash payment to assist you with resources and costs would be an excellent opportunity. Hospital indemnity is a great program to provide you with cash immediately if you were to be admitted to the hospital. We understand that while health insurance will pay for most of your expenses, there are portions of those expenses that are not covered. Things that are going to the MOOP that haven't yet been reimbursed to you because they're part of coinsurance. The advantage of this program is it pays the cash directly to you to help you not only with major medical, but other kinds of services that make life a little bit more difficult when somebody goes into the hospital. Group disability provides a benefit at 60% of your salary to a maximum benefit of $5,000. And the amount of benefit available to you is determined by how much money you earn. I should point out to you that there is a 9-month wait for maternity on this program. So if you're currently pregnant, you won't receive a benefit for the disability program immediately. However, the program, after 14 days, will pay 60% of your salary up to the amount of the benefit that you purchase. It's an excellent program at a lower cost than the Allstate program. Finally, the life insurance program is different than Allstate in that it provides a 20-year fixed level and guaranteed premium. The guaranteed issue, meaning how much you can purchase without taking an exam, is $25,000. And you can purchase up to $100,000, and you can purchase coverage for your spouse or for your children. As a quick little review, you can see that many of the programs here under AFLAC are less expensive on a semi-monthly basis. And all this information is available to you in the benefit guide, but we just wanted you to see them on the page so you have an understanding of what we had illustrated in the past. Finally, for the enrollment summary, critical illness, hospital indemnity, and short-term disability decisions can be made on the ADP. If you're purchasing 20-year term life, you'll be redirected from ADP to an enrollment site for the life insurance. And your user ID is the first initial of your first name, first initial of your last name, and your last 5 digits of your social security number, and the password is Juniper18. Don't feel compelled to memorize this. The on-site people will be able to help you. Existing Allstate coverage will not roll over automatically, and you must enroll in the AFLAC if you want to switch. Speaking of the individuals in the locations, the business office managers have done an excellent job to facilitate having individual consultations booked for anybody that wants them. We're here for the individual consults on health insurance, on Medicaid programs and CHIP by state, excellent low-cost programs that are designed for people of lower income who may not feel they can afford our health insurance, but know they need to have health insurance to avoid individual mandate and take care of their families. They can also provide help on the Aflac voluntary benefits, enrollment, and any other questions that you may have. We hope this was an excellent presentation, something that helped you to fill in some of the blanks, and we look forward to seeing you very soon. Have a nice day.